Thanks for joining us. This is Andrew Hetzler, Chief Operating Officer of American Exchange. Just wanted to walk people through any assessors in the state of Missouri with the American Exchange site. Here we are at the initial page. The URL you can see up here, americanexchange.com/Missouri, is the site that you'll have to go to. I would suggest bookmarking this page or listing it as one of your favorites. You cannot get to this site just from our regular AmericanExchange.com site. The reason being that we don't want anybody wandering onto this particular platform, which is meant for state of Missouri Ryan White enrollments. Okay, so again, that's AmericanExchange.com/Missouri. You can see here on the page we've got two different options for the plan year. And when we're talking about plan year, we're talking about the year that the health insurance is effective. So if you have any special enrollment periods, you would want to go for the 2018 plan year. For example, if you have any clients that lose coverage at the end of October or November, for November 1st or December 1st, 2018 effective dates, you would want to select the 2018 page. However, if we are doing a 2019 ACA assessment or 2019 enrollment, you would want to click on to this 2019 site. So what I'm going to do now is we'll just click onto this site and see what lies here. Basically, there's a few options on this page. You have the link to the 2019 ACA assessment, which we'll go over in a minute. Some information about the 2019 household income limits, 100% of the FPL, just so you know your clients, you'll have a general idea of which clients will be eligible for a tax credit. Additionally, we have a link to a marketplace application where you can go and enroll directly through our quoting system. Further on down the page, we have the application upload form. Many of you who are familiar with the program understand that this is where you can upload documents, proofs of income, or proofs of citizenship. So we'll take a look at this page real quick, the upload site. What we want to do, if you do have any documents that you want to upload, whether it's a print version of the ACA assessment or whether that's a print version or PDF fillable version of the ACA assessment for one of your clients, you can upload that here. And it works just the same as doing an online ACA assessment. An American Exchange agent will claim it and help your client enroll. What we would prefer is that you select the state. Okay, so we'd go down here, find Missouri. We would like the client's name. Okay, so we want to put the client's name that the document is for, and then the email for the case manager. Then you have to verify that again. Here at the final option is the option to choose the file that you want to upload. Okay, so this will take you to your Finder, okay, and you can choose your file. Once everything's there, this submit button will light up. I haven't chosen a file, so there isn't an option there. If you hit submit, it's going to give you an error for anything that's incomplete. But once that is, again, it will be claimed by an American Exchange agent. Coming back to the 2019 plan year site, there is some more information down here at the bottom. To review plans and pricing only, there's a link here to the healthcare.gov C plans. Okay, so this will take you to healthcare.gov where you can quote and look at plans for your clients. We urge you not to complete an enrollment through healthcare.gov without going through the marketplace application site here. But this resource is good for just looking at what plans are available and what the pricing is. We've got a couple links to some documents here. The fillable PDF version. Okay, so if you're at a computer and can fill in a PDF rather than do the online ACA assessment, you can do that here. Okay, so it's just all the same fields as the online ACA assessment, but in a PDF format. There's an additional print version of this same assessment. So if you need to print it out and take it to a client, fill it out, and upload it, you're welcome to do that. Finally, we have a frequently asked questions. Okay, so this is a great resource for any questions that you may have about the enrollment process. How do I upload documents? Does American Exchange keep premium information? A ton of good topics here for your review. So now we will get into the ACA assessment. Okay, so now we'll go through each section of the ACA assessment for 2019. I'm here at the 2019 plan year page for Missouri. I'm just going to click the words here, ACA assessment, and it'll take us to the assessment page. There are two kind of iframes within the page, so you might want to scroll down, and then you can scroll within the assessment here. But basically, you'll get to this. It's titled Missouri ACA Assessment 2019. You'll know that you're in the right place there. The first required question here is whether your client is new or renewal. Whether they're new to the marketplace or whether they're renewing a marketplace plan. It's important to our agents to understand that because the marketplace does produce automatic renewal applications, and it's more efficient for us to go in and enroll off of that automatically produced application than to do a whole new application and prevent the possibility of there being two applications for the same client. So a renewal client is going to be anyone who had coverage through the marketplace in 2018. Okay, even if they lost coverage in the middle of the year for some reason, they would be considered a renewal. A new client would be someone who did not have marketplace coverage in 2019. You know, they may have been a client that had coverage in 2015 or 2016, but it canceled for some reason. They had no coverage for 2018. That would be considered a new client. Okay, so list whether your client is new or renewal right here. It's a drop-down option. The rest of the information, pretty straightforward. Today's date, the date that you're completing the ACA assessment. We'd like to know what carrier that the client had last year if they are a renewal. None of this is required information, but if you have it, it is helpful for us to know what carrier they were with last year or this year, Cigna or Ambetter, their member ID and their plan name. Okay, so understandably, you might not remember that for every one of your clients, but it is helpful. Moving on to the basic applicant information, you'll be very familiar with all of this. First, last name, address, city, state, zip, the county that they live in, the client's phone number, social security number, gender, date of birth are all required fields. Okay, email is not a required field, but it is helpful to have the client's email. If you want to put yours as the assister email in there, you're certainly welcome to do that if the client does not have an email. Tobacco use is a radio button here, so we've got an unchecked button means that there are not tobacco users. Okay, so if this is unchecked, we are putting them as not tobacco. If you check this as for a tobacco user, it is asked the date of the last use. Okay, so this more closely matches the marketplace application and is something that is a change from last year's ACA assessment. We're asking for the date of last use. Okay. Moving down, we're asking for the agency name. Okay, so this is going to help us better sort our reporting by agency. So if you want to put your agency name in here, that's going to be very helpful. Next to that is the case manager name, phone number, and email. Okay, so that's your name, phone number, and email as the assister. Getting into the household information here, it's important to remember with a marketplace application that there's two different households. Okay, you've got your coverage household, which are the people that are going to be covered by the health insurance plan, and your tax household. And these households can be two different groups in certain situations. So your tax household is going to include anybody that shows up on your federal income tax return. Okay, so if you have a client that's married and has 2 children that they claim on their taxes, but they're only looking for coverage for themselves, their coverage household would be 1, the primary applicant, but their tax household would include 3 others. So, even if there are people not seeking coverage, it's important to list the people on the tax household to help determine the right tax credit. Okay, because that determines your level of FPL and ultimately the amount of tax credit you'll receive. Okay, so you would enter any information on household members here. If there is a dependent or a spouse seeking coverage, you'd indicate that here. Okay, so this radio button, if it's checked, that spouse or that dependent is seeking coverage. If it's unchecked, that member is part of the tax household, so someone that's listed on the income tax return, but is not seeking coverage. Information is pretty straightforward here: relationship, date of birth, first name, gender, last name, social security number. Again, tobacco use here: unchecked, no tobacco; checked is for tobacco. So moving on to the income section of the ACA assessment, it does require at least 1 income type response for the primary applicant. If you see here from the drop-down options, there is a no income option for those clients that are not working or in between jobs. You want to put no income. That is certainly an option. However, we do ask that if you do no income, that you complete the required fields here. Understandably, maybe a little bit redundant, but it is a required field. For most cases, though, you're going to be inputting income information for your client's estimated gross income for 2019. And that, is sometimes hard for people to estimate, especially for self-employed people or people that work part-time or in between jobs. But really, all we need is an estimate of the gross amount, and that can be changed throughout the year. So, listed here in the drop-down are the different income types. The next question is the income earner. So, for most cases, it's going to be the applicant him or herself, but there also could be cases where the spouse or dependent child is the primary head of household for the family unit. So if the primary applicant is not working but the spouse is, you would just simply list the spouse or whoever the income earner is. Okay. And then you would enter a numeric figure for the estimated gross amount of income for 2019. So $25,000. The frequency annually. If you want to put in their monthly amount or their biweekly amount, you're welcome to do that. And then the name of their employer or the nature of their self-employment. Okay, so pretty simple there. Now, if the client has a couple different types of income, we would like those broken out in each particular line. Okay, so if they work at Acme Services but are also receiving Social Security disability, you would list that here, $1,500 a month. For employee, you just put not applicable. Again, these fields aren't going to be required past the first line of income. So if you can break it out like this for us, that is very helpful. Okay. Additionally, if you have a household where there's multiple income earners, you can list spousal part here. Let's say they make $1,200 a month, and we can calculate the total estimated income for the household. Okay, so pretty straightforward there. If you're familiar with the Marketplace application, this is kind of meant to mimic anything that's required in a Marketplace app. So moving down to the client's tax information, we've got the client's 2019 tax filing status. Okay, so it's important to know how the client plans to file taxes for 2019. Here are the options based on the IRS designated filing types. Just so everybody knows, married filing separately is a tax status that does not allow the client to get a tax credit. So just to be clear, they can still get a health insurance plan, but they're not going to be eligible for a tax credit to help reduce their premium payment if they're married filing separately. The next question here is, does the client plan to file federal income taxes for 2019? Okay, so part of the Affordable Care Act, you have to file taxes to get a tax credit. Okay, so if you answer no here, you're going to be able to still get a health insurance plan, but you're not going to be eligible for a tax credit in this situation. Okay, so if you answer yes, that is probably the most common. You have to file taxes. Again, you have to file taxes to get a tax credit. Additional questions: did the client provide a copy of his or her 2016 federal income tax return or proof of extension? Did the client receive an additional federal income tax refund for returns on APTC? Okay, so just trying to help us understand, again, these are not required questions, but trying to help us understand the client's tax situation to help better run the program, kind of analyze if clients are receiving any money back from their tax credits that they may have had in years past. The last little part here of the tax section is the option to upload a tax return or proof of income. Okay, so if you see here, you can choose a file. It'll pull up your file finder in your computer, and you can upload a document. Okay, so you can upload your client's proof of income right away. Now, not all clients are going to be required to provide proof of income, but having that is a good way to ensure that the client's income part is taken care of. So if you have that information readily available, that's great. We will take it. If the marketplace does request that information, we'll have it right on hand. If you don't have it, it will be part of a report, and we will request that information from you, the assister or the case manager. Moving on to the citizenship and naturalization questions. The only required field here is whether your client is a United States citizen or if they're a naturalized or derived citizen. Okay, so most commonly we're working with United States citizens. However, if your client is naturalized or derived, we would like to have some of the following information about their type of documentation. Okay, most commonly you're going to be running into clients who are here on a green card. Okay, so most frequently that's the type of documentation that we see. So in that situation, if you have any information on that, we'd love for you to go ahead and input that information. Particularly with a green card, this alien number or the USCIS number, the card number, and the expiration date. Okay, additionally, if the client's name appears differently on that documentation than the information that was provided on the basic applicant section, we would like to know what the name is on that card. If you're not familiar with that, or if it's any of these other types of documentation, you're welcome to upload a proof of that documentation here. Once it's uploaded, the American Exchange agent will be able to read it and get all the information that we need off of it for the marketplace application. Again, that proof of upload of proof of documentation is not required. Moving past the citizenship, there's three other questions that the marketplace asks. Is the client a Native American or Alaskan Native? If your client is, there are different health insurance options available for that person. So there's kind of a different process for Native Americans or Alaskan Natives. Secondly, is anyone in the client's tax household offered coverage through an employer? remember that if someone's offered coverage at work, they're not necessarily eligible for a tax credit. So it's good to know that. We don't want to have a client that's hit with a tax penalty at the end of the year because of that. Finally, is there a client or any other female household applicants currently pregnant? This is a question for presumptive Medicaid eligibility, so if there are, we kind of have a different process to follow there. Next, we're getting to the prescription drug information. Pretty self-explanatory here. We want the client's prescription drugs so that we can ensure that the plan covers them. Okay, so do your best to spell the prescription drug name correctly. I know that they can be difficult, but put the name of the drug here, the dosage, and the frequency. Okay, if you want to, you can upload a list of prescription drugs in one of those upload spots for citizenship or documentation if there's a long list, but preferably we'd like to have it input here. After the prescription drug section is the provider information. So what is the client's preferred hospital, preferred primary care doctor, preferred HIV specialist or infectious disease doctor, and any other specialists that they may see. Okay, so again, we want to ensure that the client's prescription drugs are covered and that their doctors are covered. So inputting those doctors here ensures that we find a plan that that is approved by the state and it covers their doctors. Almost to the end here, we've got the special enrollment period section. So during October, November, December, up to December 15th, we're in open enrollment. So really shouldn't be using this until after December 15th. However, there are options here for special enrollment periods. Okay. And then finally, the disclaimers and the notices. Okay, so what we want here is if you know what plan your client wants to have for 2019, you can put that in here. Okay, it's an open text field, so you can put as much or as little as you want. You can put the plan name all together, or you can just say Cigna and the level, or as much as you want. So if you know which plan is right for your area, or for your section of Missouri, you can put that here, and that will cue the American Exchange Enrollment Specialist to get your client into that particular plan. Finally, here is the section for attestations. Basically, I'm not going to go through each one of these, but what we want to convey to the client is that we're really only using this information to help administer their benefits through the Ryan White program. Okay, so American Exchange is keeping their information confidential. We're only sharing their information with Healthcare Strategic Initiatives, HSI, for administration of the monthly health insurance premium payments. And basically want the client to understand that that is the relationship, and that is the only relationship that's going on in this form. Okay, so be sure to read these out to your client if you have time, just to make sure they understand. We take our security very seriously, so we want them to understand that their information is safe. Finally, we have the Save button here. And I'm going to go ahead and click just so you can see what it looks like for all the fields that are left open. Okay, so any required fields, you're going to get a pretty visible red notification. Okay, and if we go back through the fields, you'll be able to see exactly what was unanswered pretty clearly. Okay, so it should be pretty obvious. If you're having trouble, there's a chat box here where you can chat with an American Exchange agent, or if you're having trouble with the assessment, you can call the Missouri Designated Hotline here at the top. So that's about it. Hope you enjoyed the video. I hope it was helpful. If you have any other questions, just give us a call at American Exchange. Thank you for your time.